Okay.
Hello, I am Dr. Musariri. I am the medical superintendent of St. Albert's Mission Hospital in Centenary District, Zimbabwe. We have met some time, but we are crossing a very difficult time for our services to the poor, the needy. And here I am sitting in the dispensing room where patients come and pick up their medicines. These days it's very difficult because 3 days ago we ran out of syringes and needles. We ran out of gloves, sterile gloves. We ran out of every other thing. There is the national pharmacy which should give us the medicines. They should bring them in a truck in order to stock us up, but this is not happening these days. So I, as a consultant, I need to write a prescription for my clients. And when I write, it is so painful because sometimes it's just writing. If I have to write an injection, let's say I'm giving ceftriaxone, 1 gram twice a day, then the patient must go and buy 10 vials, and on top of that, 10 syringes and 20 needles. They swab and then bring them to me in order that I give it. But then very often, the relative who goes out there, which is 54 kilometers, the nearest private pharmacy you can go to, or 120 kilometers, the next one. The relative comes back 5 days later to tell me that was unable to go and procure the medicine. And I still have got the ill patient in the bed doing nothing for her. It's so painful for a medical practitioner to have it that way. It is not only injectables, but also gloves. If I have to go into theater in order to deliver a woman by cesarean section and I don't have sterile gloves, it means that I am forced to transfer the patient to the next facility, which is the government hospital 200 kilometers away, so that she can have a cesarean section there. It all depends on what type of cesarean section one has to get. Is it because the baby is distressing, or is it because the mother is unwell? So it's painful, it's difficult. And out there, I know sometimes we have these resources. If you can help me, by extending your hand, it will help us to help these poor people out here. Thank you so much for your help. Thank you for your support.